Next on Being Well, Dr. Jacob Pschirrer from Pschirrer Family Dentistry in Charleston stops by to talk to us about dental health and what we need to know to keep our teeth and gums healthy for a lifetime. We've got that and more next on Being Well. Dr. Pschirrer, Jacob was what I'm used to calling you. Thank you for coming on Being Well. You're our first dentist that we've had on the show.
Well, it's good to be here.
So we're going to get into all of the dental pain and issues, which brings about my first question. Teeth are small. Why do they hurt so bad when you have a dental issue?
Okay, well, let's do an example of breaking your arm. Say you break your arm or get bruised real bad. You know, it hurts because swelling, inflammation causes pain, squeezes on the nerve. But that swelling can give. In a tooth, there's also nerves, blood vessels, and swelling. It can't give. It's all stuck inside that hard case. There's nowhere for the nerve to go. So that blood gets more, excuse me, more and more blood gets in the tooth and squeezes that much more in the nerve, causing horrible pain.
Yeah, if you've experienced it, you never forget.
Yeah, I've heard it's horrible.
It's very bad. So other than obvious pain, what are other health issues can arise if you have dental problems? They can lead to other things?
Yes, it can lead to periodontitis, which is gum disease, can lead to systemic effects as of cardiovascular disease, strokes, heart problems, low birth weight in children, increases your risk of diabetes.
Really?
Those are all pretty serious things. Another thing is when you're missing your teeth or you have a lot of dental pain, it's malnutrition. You can't eat what you're supposed to eat. You can't eat your broccoli. You can't eat carrots. You're pretty much stuck with eating liquid foods and stuff like that, which is not the best for you.
Yeah.
Another thing is, Dr. Kavanaugh was in here in the spring. He talked about how important it is to smile and laugh for your health, right? Well, if your front teeth are decayed, missing, you're scared to smile, you're scared to laugh. You tend not to go out as much and do as much social things. So that can affect your overall confidence and health also.
Yeah.
So those are just three of the main things.
That's a very good point. Let's go backtrack and talk about children, because we had some parents ask some questions about when they knew you were coming on the show. When do you recommend parents take their child to the dentist for the first time? Okay,
it's usually between the age of 1 to 3.
Okay.
1 seems off early. 3, you like to get a cleaning done, positive experience. You know, you're going to count their teeth. You're going to mainly educate the parent about what's good food, what's bad food, when to brush, when to floss. The ones what they recommend, it's kind of pushing it, okay? As long as the pediatrician is informing the parents about good brushing habits, good food, stuff like that, then they can probably wait until they're 3 to get it cleaning, okay? The main thing is not to push it.
Okay. So I should say, when should parents start brushing their children's teeth? At what age do you recommend?
What's funny is I recommend brushing before they get teeth. When they get home from the hospital, you want to use a wash rag, clean their gums every single day, and get them used to having their gums clean, having your finger in there. If you go in there age 3 and decide you want to brush your teeth, they're going to reject it. They're not going to be very happy.
And they have teeth, which
and an attitude, and they're not going to want to do it. We start off early, brushing their gums. And then, move on to brushing their teeth. Their first teeth are around 6 months to 12 months, give or take. We start with a little bit of toothpaste. They call it a smear amount, which is just a grain or ice amount, and you smear it on the toothbrush so they can't swallow it. So you brush your teeth, morning and night. And if they want to brush, well, they can brush afterwards. But you brush them first, make sure it's done, and then you graduate to a pea-size amount of toothpaste. Okay. Once they can spit out the toothpaste and don't swallow it, brush them every night and day. And again, if they want to brush afterwards, they can go ahead and brush afterwards also. But main thing is you brush your teeth every night, every morning.
Okay. Even if, they're going to lose those teeth anyway?
Oh yeah, for sure. Again, decayed baby teeth hurt also.
Yeah, they do.
Again, nutrition. I've seen decayed teeth where kids can't eat properly. Also, the baby teeth hold space for the permanent teeth to come in. So their permanent teeth are going to be straighter when they come in if those baby teeth are left intact, decreasing the chance for braces.
So are there types of foods and things that cause dental decay, like in kids? So if you give your kid a bottle with juice or something in it, does that lead to more problems?
Yes, it leads to a lot more problems. Juice, everyone thinks is, even organic juice, even no sugar added juice, horrible for teeth. Okay, not good. It has as much sugar, an 8-ounce glass of juice, as a pop. That's not good. You're bathing the teeth in this sugar. Now, if they want to have some juice, say on a Saturday night, your family's out to dinner.
Right.
That's fine. Just go home and brush your teeth. A sippy cup, which is basically a glorified bottle, full of juice all day long, horrible on a kid's teeth. Put them to bed with juice or even milk, bad idea.
What is it in the juice? Does the sugar just eat away at the teeth?
The sugar actually feeds the bacteria, which are coating the teeth basically at all times.
Okay.
Okay, and then they start eating into the teeth. So by constantly taking a sip of juice, you are feeding those bacteria and causing more cavities.
Okay. Here's a question that one of our staff people with a young son posed. Does thumb sucking make a child's teeth crooked or lead to maybe that they're going to have braces later on?
It definitely increases the chance of needing braces. The sucking motion on the thumb actually kind of bucks out your top teeth and pushes them forward.
Okay.
Yes. It's a tough habit to break. You don't want to force the child to quit because then it's going to be a taboo and they'll want to do it more. A lot of times they'll quit on their own. If not, orthodontists have devices that they can place in the roof of your mouth to get them to stop. It's usually not a major problem, but you can tell a lot of times the kids that suck their thumbs.
Okay. Well, let's talk about, you're a dentist, so I'm sure this is, you know that people really don't like to come see you. I hate to break that to you.
I know, you're killing me.
But some people do have this fear of the dentist, and, what can we do to help get ourselves over that fear? What do you recommend?
What do I recommend? Okay. Dentistry has gotten a lot better over the last.
It's not like it was in the 1800s.
It's not like it was yet, and it's probably gonna get a lot better also.
Yes.
Yeah, it's a lot different. Dentists don't think of a patient anymore as just a piece of meat with a mouth and teeth sitting on a chair. We know patients have feelings, emotional and physical feelings. So that's a whole. It's a whole combination, not just sitting there drilling on someone's teeth. You want to make the person happy, comfortable as can be. You use stronger anesthetics in the war back when we used to use Novocaine. We don't use Novocaine anymore.
Oh, you don't?
No, that's so old.
Okay.
It didn't really work as well as the things I have now. Appointments are shorter than they used to be. You can get a root canal and a crown now in 2 visits, where it used to be anywhere from 4 to 5 visits. So less having to pump yourself up to go.
Yeah.
If anything ever hurts while you're at the dentist, raise your hand. If you need to swallow, if you need to breathe, if you need a break, raise your left hand, and it'll stop. It's not just lay down and let's get this done.
Yeah. Well, and the size of it's not Novocaine. What is it that you use?
Septicaine is the main strong one. Sit-in-S is another one, but just a lot better than Novocaine.
Well, and the size of the needle, we used to think it felt like it was about this big. It's very tiny.
Yes, it's very tiny.
When it goes in, it doesn't.
Yeah, a lot of children don't even know they get it if they're not, if they don't know it's coming, a lot of times they don't know it.
Okay. So as an adult, what are some things that we can do to sort of calm ourselves before we go into the dentist?
Breathing techniques.
Breathing.
Breathe deep. I always tell people during injection, breathe. Don't hold your breath. Holding your breath actually increases anxiety. So you want to breathe. Ask questions. If you have a question, ask the dentist. Don't think, is he on the wrong tooth? No, ask him. He's not, but ask him if you think it's, if you get confused which side it's on. Ask the dentist. There's a lot of things you can do to help, relieve anxiety. To a greater extent, some doctors actually prescribe their patients a pre-medication, Valium or something like that. Their physician will, and that works for some people.
Okay. So I've been to the dentist several times, and when they open your mouth, they're rattling off different teeth, and there's different distal watch and different things. What does that mean when you're going through our teeth, looking at them, those different terms?
Distal just means, dental terms. Distal means the back side of the tooth.
Okay.
Farther from the midline. Okay. Mesial means towards the midline, which means the front of the tooth. Buccal means cheek in Latin. So that's the outside of your teeth. Lingual means the tongue side of your teeth, because that's where your tongue is. It's just saying, there's a cavity. A DO would be a distal occlusal, which occlusal is a chewing surface, the occlusion. So a DO would mean a 2-surface cavity. That's all it is. A wash would be, it's not quite through the enamel yet. Let's take a look at it in 6 months and see how it looks.
So you don't automatically fill everything you see?
Oh,
in
no,
repair?
no.
Okay. How do you know when it's time? I mean, obviously if you come in to the dentist and you have a cavity and you're having pain.
Yeah.
But some of them you can just sort of keep a watch on for a while?
Yes, it depends on the person too, but if it's not quite through the enamel, the decay, well, we'll keep an eye on it. Now, if they have horrible hygiene and there's plaque, which is a bunch of bacteria built up on their teeth, well, it might make it 6 months. It might be a pretty big cavity 6 months. Usually not, but they're not going to come back, say, for 3 more years, and they're not going to come back for three years. You might be better off just filling that tooth.
But if you have the start of a cavity, you can't really, can you do anything to prevent?
If you floss every day, remove that plaque, and change your diet, lay off pop, hard candy, sticky candy, stuff like that, then yes, it won't get better, but it will stay the same.
Okay.
We've watched ones for 6, 7, 8 years.
Really?
Yes.
Okay, let's talk about flossing, the thing that everyone lies to you that we do.
We know everybody's lying too.
Why is it important to floss?
What floss does, it removes plaque and bacteria from in between the teeth.
Okay.
Okay, it's a very, very simple system. There's nothing difficult about it. At least every night, ideally after every meal. But people don't want to do it during work.
Yeah.
It's basically removing plaque, which causes gum disease. Plaque and bacteria cause gum disease, and gum disease will eventually eat away at your bone and the gums around your tooth, and your teeth will get loose and eventually fall out.
Yes. Okay.
Yes.
It's like a.
Yes, along with cardiovascular disease and increased chance of diabetes and low birth weight in children. Yeah.
Just from not flossing.
Yeah. What it is, it's a unnatural infection in your mouth. If your arm's infected, you go to the doctor. If it's bleeding,
Right.
if your gums are bleeding, your mouth's infected, you don't worry about it. So it's in your mouth, you don't worry about it, it seems like. But yeah, it's an infection in your mouth and get into your bloodstream.
Okay.
And travel throughout.
All right, so let's probably common dental procedures are probably you go in for teeth cleaning, cavity filling, root canal. How do you know the difference if you need a cavity versus a root canal? What's really the difference?
Well, a cavity is superficial. There's 2 layers, the dentin and the enamel. Enamel is the top part. Filling, it's in those 2 surfaces. When the decay goes through the enamel, through the dentin, down to the nerve, what's called the pulp, that's when you need a root canal.
Okay.
The bacteria are multiplying inside the pulp, causes inflammation, very painful.
So what do you do when you do a root canal? It sounds so awful.
Yeah.
It's really not.
That's why I call it endo. It sounds less endodontics. It sounds less threatening. What you do is you get the person very numb, of course.
Yes.
Remove the decay goes to nerve. Well, you remove the nerve or nerves from that tooth, anywhere from 1 to 4 nerves. You remove those, disinfect the canals, and place a filling material into each of the canals.
Okay.
Then put a temporary in there. So we're not pulling the roots out. The roots aren't going anywhere. 99.5% of them are pretty painless. Sitting there with your mouth open for a while, it's pretty annoying.
Yeah.
But you have bite rest, or dentists have bite rest, bite blocks for you to bite on during the procedure.
So I know this from personal experience, do all root canals lead to eventually you need a crown?
You almost always need a crown after
And
a root
why
canal.
is that?
When you remove the blood vessels from a tooth and the nerves, the blood vessel brings water and moisture to the tooth, right, making it a little more flexible. When you do a root canal, you're removing those blood vessels, removing those nerves, water's no longer going to the tooth, it becomes very brittle.
Okay.
Snaps off. Also, the tooth needed a root canal probably because it had a large crack or a lot of decay anyhow, so it's already a weak tooth. So a crown just strengthens it up.
That crown just goes over the top
Yeah,
and
just like this.
sort of.
Cap and a crown are the same thing.
Okay. We talked a little bit about gum disease, and that is actually a lot more problematic than I thought. How do you know if you have the beginnings of gum disease?
Well, the first stage is gingivitis, which almost everybody has had. When you brush your teeth, you spit in the sink, and there's blood in there.
Okay.
Almost every kid has it, almost every kid. Your gums are puffy, red, again, bleed. Pretty painless, but it's the first stage. That then leads to periodontitis, or gum disease, where you start losing your bone, losing your gums around your teeth, more blood, possibly some bad breath, stuff like that. How do you know you have it? You go to the dentist, they take x-rays, or do some probing, whatever it takes to find out how much bone loss you've lost. If it gets severe, of course, you need to go to see a specialist, a periodontist. But mainly it's going to the dentist because it's painless.
Right.
You don't know gum disease. You don't know you have it until you go to the dentist.
So can it be reversed?
Gum disease cannot be reversed.
Okay.
Gingivitis is reversible. Brushing, flossing, it will go away. Periodontitis will not go away. It can only keep it at the level it's at. So say you've lost 2 millimeters of bone, which is, very,
Tiny.
yeah, but in your mouth it's a lot. If you lose that much, you can never grow that bone back.
Okay.
A bone graft will not do that. You can only keep it at the level it's at.
Okay. So floss twice a day.
Yes, floss, can't, yeah. And they have little floss holders too to make it easy.
Okay. Let's talk a little bit about when do you decide if a tooth needs to be removed, or can it be repaired and crowned? And
Okay.
what makes the decision?
Okay, say the decay or the cavity is so advanced that's below the gum line. The tooth is almost flat with the gums, decayed, even a gum surgery can't save it. Well, then that tooth needs to be extracted.
Okay.
Another example is, say you bite on something just wrong, piece of ice, which is bad. You split the crown, you split the tooth right up the root. So it's split basically in half. No root canal or anything can save that tooth. That tooth needs to be taken out.
Okay.
Okay. Another one is gum disease, periodontitis. Say there's bone loss is so bad that the tooth is kind of just
really nothing.
waving in the wind. There's nothing to do with that tooth except for take it out. So those are the three main things.
Okay, we've got about 5 minutes left. I'm going to shoot some rapid fire questions
Okay.
at you. Okay, we've always seen, if a kid loses a tooth, put it in a glass of milk. Can you put it back in?
Yes, you can.
Okay.
The very best thing is put it in your cheek and keep it in your cheek because it has a right amount of saliva. Teeth like saliva. Put it in your cheek. Call your dentist. I've put one in one time, came all the way out. Kid put it in his cheek, and he still has it today. And it's been 4 or 5 years now.
Really?
Yeah, I'm still amazed.
That's amazing. Okay, whitening products. They're all over the market, all over TV, over-the-counter things. Good or bad for our teeth? Make them look good.
Yes, they're not harmful. They can make your teeth sensitive. If that's the case, just back off. It's not doing any harm. Just back off. Keep them off of your gingiva, off your gums.
Okay.
Those whitening products get in your gums, and they can cause burns.
Okay.
Some whitening products even have fluoride in them. So actually give yourself a fluoride treatment while you're whitening.
Okay. All right. Talk about sensitive teeth. What really causes sensitive teeth? Like if you sensitivity to cold.
Okay, to cold. Well, first of all, you want to get to your dentist, make sure it's not a cavity, a deep cavity causing the pain. If that's not the case, well, then you want to possibly go to over the counter at the drugstore and get some sensitive toothpaste. There's 3 good ones out there, at least 3 good ones out there.
So what does the sensitive teeth toothpaste actually do? Because do you have holes in your teeth? Is that, or not microscopic holes?
They don't want to tell your secrets, but yes, right? It's filling the microscopic holes.
Okay.
Sometimes gum recession also exposes your root surface, not your nerve, exposes your root surface, and that can cause sensitivity also.
Okay.
If that doesn't work, to add a prescription, toothpaste
Okay.
is even stronger than that.
Okay. Is there something that the dentist can do for sensitive teeth? Can they apply something to
Yes,
your
we can apply something to the root surface. If you have a lot of recession, we can put a white filling material over top there, and
Okay.
that takes about 95% of the feeling away.
Okay. All right. Jaw issues like grinding, TMJ, that sort of jaw clenching. What are some of the signs of that? If you don't know that, maybe what are some of the signs that you're maybe clenching your teeth too much or grinding your teeth at night?
Well, you wake up with soreness in your jaw.
Okay.
One thing, temporomandibular pain, which is where your jaw is connected to your skull. That can cause you have some pain of that in the morning. The dentist can see there's wear on your teeth, actually
Okay.
wear away the enamel. Those are some signs of that, caused by stress, chewing too much gum, chewing hard candy. Repetitive chewing that you should not be doing can cause that.
Okay. And there's mouth guards and things that you can get to sort of soften that surface. Okay.
Wear a mouth guard at night.
Okay, let's talk about the things that we shouldn't be eating. I know you're not a big proponent of chewing on ice. What are some other things that we might do that we might not realize are actually not very good for our teeth as far as, habits or kinds of foods?
Pop is Dr. Good in the pop, and I'm the same way.
We just talked to a dietitian who talked about soda.
It's delicious, but boy, it just tears up your teeth. It is horrible, horrible. It's got acid in it, and it has sugar in it. Bacteria like acid, and they like sugar.
Okay.
It helps them destroy, and it coats all your teeth with that sugar. Even diet pop has a lot of acid in it. A lot of acid, no sugar, but a lot of acid. Again, it weakens your teeth. Again, juice, smoking, horrible for your gums, horrible for your teeth. Causes cavities because it makes you have a drier mouth. Constricts blood vessels, so you have less blood flow going to your gums, causes recession. Chewing tobacco, again, bad for your gums, which also is a little more obvious. Sticky foods, chocolate cookies, that stick to the roof of your mouth, or stick to your chewing surface of your teeth. You don't want to eat a Oreo and then go right to bed. Not a good idea. It's good to have a snack, but brush and floss afterwards.
So what is the deal with chewing on ice?
It just breaks teeth.
Really?
That and popcorn. Those two things, popcorn and ice, I see break more teeth than anything else. You think you're being good with those two things, but you're really breaking teeth.
So as much as you maybe like to munch on that crunchy ice that you can get out of the
That's not as bad as a big, those big cubes you get at home.
Okay.
But probably the smaller ones, probably not as bad.
Okay. Just because it's so hard, does it have anything to do because it's cold? Does it make your teeth more brittle?
I haven't heard anything about that. I haven't really heard anything about that.
Okay.
But mainly just it's hard.
Okay. So regular toothbrush versus, the spinny kind of toothbrushes, or those kinds that really vibrate.
I like the really vibrate ones.
Okay.
A lot. At first you're like, whoa, this is too much for my tongue, too much for my mouth. It does take about a few days to get used to it. They do all the work, so you're not brushing your gums away. They have a timer in them, so you're not done, one and done. It makes you brush for 2 minutes, which is a long time. Bring a book with you. But yeah, I really like those rechargeable electric toothbrushes.
Okay. So finally, as we're wrapping, just give us some basic tips for overall good dental health for a lifetime.
Flossing. Can't say it enough.
Flossing.
Floss.
And don't
floss.
lie about it with your dentist. They know.
We know. When there's blood all over your shirt, we know, or your napkin. Floss your kids. It's easy. It takes 20 seconds to floss your kids with those little floss holders. You can buy them in a big bag. Just 20 seconds. Avoid sugary drinks, hard foods, sticky foods. You can have a treat. I mean, everybody has treats. Just brush and floss afterwards. Don't make it happen. Don't have a candy drawer for the kids or adults or whatever, because they're going to hit it when they're not supposed to. After a meal, have a snack. Don't put kids to bed with milk or juice. Just water. That's brushing, flossing. Really, that's about it. See your dentist.
And see your dentist.
Yes.
Twice a year, once a year?
Twice a year, unless you have gum disease, then it's 3 or 4 times a year. Then maybe you go see the periodontist.
Okay.
Another thing is sealants for kids and fluoride. All the bottled water now with children, they're not getting the tap water that has a fluoride in it. We need that fluoride for the teeth to get stronger. Dental sealants on the back teeth of children will decrease their chance of getting cavities by 7.5 times versus a kid that didn't, over 2 years versus a kid that didn't get sealants. So, it helps a lot.
Okay. Well, thanks for coming on Being Well, Dr. Pschirrer, and sharing good dental health with us. I appreciate it.
You're welcome. Thank you.
Being Well is also available online at youtube.com/WEIUTV. Just look for the Being Well playlist. Here you can view current as well as past episodes. A plate of pasta with your favorite tomato sauce could help you reduce your risk of stroke. According to a new study published in the Journal of Neurology, eating tomatoes a few times a week could reduce your risk for stroke up to 55%. That's because tomatoes contain a powerful antioxidant called lycopene that's good for brain health. Scientists have found that those with the highest levels of lycopene in their blood were less likely to have a stroke. The study also found that cooked tomatoes seem to offer more protection than raw. Though the study looks promising, experts say we can't necessarily give all of the credit to lycopene. Researchers say perhaps better health habits, not necessarily just lycopene, lead to fewer strokes. Imagine this: excruciating pain every time you brush your teeth, scratch your nose, or even crack a smile. That's the reality for people who suffer from what's called trigeminal neuralgia. It's a condition that causes intense bouts of pain in your face. For the woman you're about to meet, it was debilitating.
Ready to go?
Ready to go. Pain. That's the word, it's pain.
Fida Webb can't quite believe she's on the back of her husband's bike and enjoying it.
Even just a little wind, it triggered the pain.
Fida had trigeminal neuralgia. It's a condition that caused repeated attacks of intense, stabbing pain in her face 3, 4, or more times a day.
Scale of 1 to 20, probably more than that, 25, 30 or so.
So bad that Fida says her life stopped. She didn't want to do anything because just about everything, smiling, talking, or moving, sparked it.
7 years, I was in a depression.
Many of these patients come to the office and they're very, very desperate.
Dr. Ronald Reimer is a neurosurgeon at Mayo Clinic. He says some people who come to his office have lost weight because it's too painful to eat.
There's various treatment options for younger and healthy patients. The most definitive way to treat the problem is by what we call a microvascular decompression.
That involves removing a small piece of bone behind the ear to access the source of the pain, a blood vessel that pulsates against the trigeminal nerve and over time damages its myelin sheath. Then Dr. Reimer moves the vessels away from the nerve and places a pad between them to keep them apart. Another less invasive method involves making a tiny nick in the cheek through which doctors insert a blunt-tipped needle followed by a balloon. The instruments are guided to the site where the nerve exits the base of the skull. When they inflate, the balloon creates pressure that allows Dr. Reimer to cautiously compress the nerve and block pain signals.
Sometimes that procedure takes as little as 10 minutes and should give fairly immediate relief of pain.
Oh, the pain, thank God it's gone.
It worked for Fida.
Oh, my life was back. I mean, I can smile, I can kiss my husband, I can just giggle.
Fida knows there's a chance the pain could return. If so, she says she'll sign up for another procedure. For Medical Edge, I'm Vivian Williams.
Well, we're out of time for this week. Thanks for joining us. And remember, if you have questions or comments, please send them to us at weiu@weiu.net. For Being Well, I'm Lori Casey.